You're listening to EPN, the E-Podcast Network.
This is Enterprise Fit Radio and your host, Eric Dye.
This is Eric Dye, and once again, welcome to Enterprise Fit Radio here on EPN, your location for health and fitness information for the busy entrepreneur. And as we all know, without good health, you cannot be successful nor productive. Today, we're speaking with Dr. Paul McCool, the co-founder of the Center for Innovative GYN Care, a minimally invasive GYN surgical practice for treatment of fibroids, endometriosis, and pelvic pain. July is Fibroids Awareness Month, and Dr. Paul McCool is here today to talk to us about the racial disparity in GYN healthcare. And Dr. McCool, thanks for joining us here today on EPN.
Great. Glad to be here to talk about this interesting topic.
And I'm sure our audience is certainly looking forward to hearing from you as well. So tell us, for starters, what is a fibroid, and is it true that African Americans are more predisposed to getting fibroids than other races? Let's start there today.
Yeah, fibroids are essentially an overgrowth of the lining or the muscle of the uterus. So the uterine muscle has fibrous strands in it, and in some patients, those strands grow from estrogen. So estrogen makes fibroids grow. And what happens is fibroids grow, they cause many problems. In African Americans particularly, there's a higher prevalence for fibroids, and it's probably more genetic. With more fibroids comes more bleeding, pain, more severe symptoms. And if those fibroids are starting at a younger age, which occurs in many African Americans, they have a longer time to grow and cause more problems. So it really is one of the most common benign tumors in African Americans. Looking at specifically the diagnosis and how these fibroids are diagnosed in African American women, they're about 3 times more likely to get fibroids than are whites. And the age of onset is about 20 for an African American woman versus in the 30s for Caucasians or white women. And the symptoms are more severe. So if they're starting earlier, the symptoms get worse faster for them. When you look at what happens with racial disparity, there was a study back in 2013 by Elizabeth Stewart, and she looked at the differences and found that really African Americans had a higher occurrence of symptoms like heavy menstrual bleeding and pain. Bleeding itself causes anemia. And anemia is a low blood count. And what happens is anemia will cause fatigue. People can't function normally. They can't go to work on time. They often miss work. And in many ways, it avoids people from exercising and being active, and they gain weight in the process. Pain and frequency of urination, fibroids press on the bladder. And that's really a mechanical issue, right? The fibroid hits the bladder, decreases bladder capacity, and people are peeing more frequently. All of those things affect normal abilities to function and to do things. And the other thing that really happens with fibroids is fertility. So pregnancy is really important for African American women. Actually, 71% said preserving the uterus was important to them by Stewart's study versus 41% of white women. And as fibroids grow, they will cause problems with fertility. So you can see there's a lot of different issues when we look at what happens to an African American population with fibroids versus Caucasian, and why those issues need to be addressed more succinctly and more rapidly in that population.
Certainly do appreciate the information on that. That is most helpful and a great place to kick things off here today. Now, also, what should women ask their OBGYN to screen for during their annual visits, even if they are not experiencing any symptoms? Give us some good detail on that.
Well, that's a great question, because you think about what happens with treatment in fibroids and screening. If you can't find them, you can't treat them. So one of the things that is the most important process for any woman of any race to talk with their OBGYN about is getting an ultrasound. Pelvic exams do not cut it. It's that simple. There's so much data on how pelvic exams are not effective. They can be uncomfortable. They can't pick up fibroids. So get an ultrasound. A lot of these OBGYNs have ultrasounds in their offices. So, if the patient asks for that scan and fibroids are identified earlier, then delay in care is avoided. Delay in care means they're growing, they're getting bigger. The patient doesn't know they're there, or the patient is having symptoms that the OBGYN is not responding to. When you take a look at treatment and diagnosis and treatment, since most African Americans are very, interested in having children, and their fibroids are starting earlier and growing faster, if you don't get an ultrasound, you can't pick them up, and they are at a 7-fold risk of needing fibroids removed at surgery. They also, unfortunately, undergo hysterectomy 2 to 3 times more likely than white women, and that's because the fibroids are growing longer and not being picked up. So, again, that ultrasound is the most important part of your exam with an OBGYN. It has to happen.
Yeah, definitely some good information there as well. Now, what are some of the risks associated with fibroids if left undiagnosed and untreated? I'm sure listeners would need to hear your feedback on that.
Yeah, here's where the patient really comes in. You have to be your own advocate. If you are not your own advocate, your OBGYN in many cases is not going to be that advocate, and you're going to have a problem with fibroids. So you've got to, first of all, make sure that you understand what fibroids can do to you if they're not diagnosed. They can cause pain, as we've mentioned, heavy bleeding. They can cause infertility. The whole idea of an OBGYN telling a patient, let's just watch and wait and let them grow, and we'll deal with those fibroids just before you want to get pregnant. Well, think about that. Patient has a fibroid that's 1 inch or 2 inches in size and is not causing many symptoms, and they're waiting for pregnancy in 5 or 6 years, and they're doing an exam, occasional ultrasound, and all of a sudden that fibroid is now 8 or 10 inches in size. When you take that fibroid out with myomectomy, there's going to be a problem potentially to scarring to the fallopian tubes, which transport the embryo into the lining of the uterus to form a baby, or just healing or scarring that causes problems with fertility. So larger fibroids, multiple fibroids will cause problems in getting pregnant. And of course, along the way, symptoms get worse. One of the risks associated with fibroids growing is that they will cause pain and bleeding and anemia and pelvic pressure and bloating and distension and all of these things that we see all the time in patients with fibroids. So really, those are the risks if they're not diagnosed and treated. And patients really, need to understand that if you're having symptoms, get an ultrasound. Going back to that again, an ultrasound will let you know what's going on. Get a copy of that ultrasound report. Don't rely on a busy OBGYN whose primary practice focus is babies, delivering babies. Don't have that OB get back to you. You get a copy of that scan so an early diagnosis can be made. Finally, one of the last points on this is, birth control pills. OBGYNs tend to just give patients birth control pills for a lot of different conditions, whether it's endometriosis or fibroids. And whether or not it's effective, rationalize that the fact that birth control pills have estrogen in them, and estrogen makes fibroids grow. If you're taking birth control pills over the long term, the fibroids will get bigger. We often see endometriosis with fibroids. Endometriosis has symptoms similar to fibroids, such as heavy bleeding and pain and other issues along with fertility problems. And birth control pills will cause endometriosis to grow over the long term. So really be your own advocate. Get that ultrasound. Get a copy of that ultrasound. And make sure that you understand what's going on with the uterus at the time of that consultation or directly after.
Certainly some good advice right there, and thank you so much. Today we're speaking with Dr. Paul McCool, the co-founder of the Center for Innovative GYN Care, a minimally invasive GYN surgical practice for treatment of fibroids, endometriosis, and pelvic pain, and he's joined us here today on Enterprise Fit Radio, a part of EPN, the Enterprise Podcast Network. Now, Dr. McCool, can you speak to us about the normalization of pain with GYN conditions?
Yeah, African American patients, unfortunately, who have a higher incidence of fibroids have more pain. Now, think about what happens in some of these offices, when patients go in with pain. Well, it's part of your normal cycle, or everyone has pain during the period. No and no. Pain should not be so severe that it becomes what we call incapacitating, that you're in so much pain that you can't even function or work. Or even if the pain is getting worse over time, this is not normal. So what can happen with the normalization of pain, as that term is saying, is that pain is expected, pain is normalized. again, the patient needs to be the advocate here and say, I understand my OBGYN is busy. I understand my OBGYN is seeing pregnant patients. I understand that my OBGYN spends greater than 50% of their practice dealing with pregnancy. I'm a GYN patient. I have fibroids. I have pain. I need to know why. And in that particular situation, getting an ultrasound and even getting to a specialist, especially for African American patients, is really important. Normalization of pain leads to progressive symptoms, and then you often get patients who are in the African American population getting treated very radically for fibroids, such as with hysterectomy. That's not necessary. So you can see why it's so important for patients with pain to get answers and seek specialist intervention if needed.
Now, I believe you touched on this earlier, but can fibroids affect a woman's fertility? Touch on that a little further. Get into some details there.
Yeah, it's really crazy what's happening out there in medicine today. There's technology available that, treats patients in many different situations, but fibroids are unfortunately different. Let's take uterine fibroid embolization, or UFE. What that term means is that a catheter is going into the groin, the large artery of the groin, and it's being threaded into the uterus, and you're pushing little pellets that stop blood flow to the fibroids. And it sounds great, right? No surgery. I'm going to treat my fibroids this way, and I'm going to have a good result. My bleeding is going to stop. The problem with all of that is that embolization procedures actually do increase the risk of miscarriage. They do not treat the fibroids completely. The fibroids stay in position. So if you get an embolization and you have a big fibroid, it may not treat the fibroid fully. It will increase the risk of damage to the uterine muscle. And further, that fibroid is going to shrink some but not go away, and the bulk symptoms can still be there, like pressure on the bladder, pressure on the rectum, and all these things. So it can affect fertility and won't actually get the fibroid out, which can also be an impact on growth of the baby. So many people get embolized, unfortunately, for fibroids, and that can affect fertility. So really it's more the treatment that we're seeing, the delay in care with growth of fibroids that affect fertility. If the fibroid is removed in the early stage of its growth pattern, when it's smaller, the fertility effects are minimal. But as they grow with delay in care, you get problems with the treatment that can affect fertility. Even a myomectomy on a huge uterus, of course, can cause problems with pregnancy. MRI-guided ultrasounds or radio frequency ablation, those are other ways to treat fibroids which also can impact future fertility. So to summarize that, think about what we've said. Fibroids come earlier in African American population. They grow faster and are larger. They can cause major problems with non-fertility issues, and definitely as they get bigger, it can cause problems with fertility in the process of treatment or just because they're there. So the longer they wait, the longer they're not treated, the more likely they're going to get a hysterectomy, and the more likely they're going to get infertility as part of the process of treatment. So really important to think about fertility in relationship to fibroids.
Yeah, most definitely there. And lastly, what do you suggest a woman do if she feels as though she's not being heard by her primary physician? Any advice in those regards?
Here, we got to be a little more clear and really talk to patients about who's managing them. It's the OBGYN. And I've mentioned several times that the OBGYN is really preoccupied with deliveries and pregnancy. Think about it. You've got a waiting room full of pregnant patients, and you've got a GYN patient in there with fibroids. The answer is not just to do a pap smear, do a pelvic exam, and send them out the door. You need to make sure that you're getting treated properly. Get the ultrasound. If you still don't like what you're getting from your OB as far as treatment, then realize this is not a marriage. You are not married to your OBGYN. You can maintain your relationship with your OB and go find a specialist that treats you and properly, and then get you back to your OB for care. And this is a real problem with trust in African American populations and all populations. That bond of trust that definitely develops with patients seeing their OB sometimes needs to be broken. If you have to get a divorce, you get a divorce. Get your fibroids treated, preserve the fertility, and make sure that your symptoms are handled, because it can affect you, overall So you have to be an advocate for your own health. That's the issue. You feel symptoms, they're not being treated properly, they're getting dismissed, get a second opinion. And, get on it and find someone who will properly treat you. Those second opinions essentially are specialists. So if you have a specialist that deals with just GYN conditions and just fibroids or endometriosis and does no OB, that's a specialist for you. Again, a specialist here is someone not doing obstetrics, concentrating all their time and effort on GYN care. And essentially, those surgical specialists will give you a better outcome than the OB will and manage you appropriately.
Dr. McCool, really do appreciate your time and your visit with us here today and your insights shared on the program per your expertise. Really appreciate it. Before you go in conclusion, any closing thoughts, a final word, or anything else you'd like to add as we conclude today?
Well, again, CIGC is one of those specialty practices. So our main issue is just education of patients. We want to make sure that you empower your physician, take control of your health, get the treatment that you need. And that's really what you're seeing the doctor for. Dismissal of symptoms is not acceptable. Again, ask for an ultrasound. You know what's going on with your body. You're the best advocate for your health. And get yourself treated appropriately. And remember that, fibroids really are a surgical issue. We touched on this a little bit. They're not an issue to be treated by embolization or other managed situations because overall the results are pretty dismal. So when many African American patients are told by their physician or their OB/GYN to watch and weigh, pain is normal, it's common, it's really not. Don't watch and weigh. Pain is not normal, that's progressive, and get to the specialist. We also know that, I've been treating African American patients for 25 plus years, and I've seen everything from, physicians in different localities not being well qualified to care for these patients, and sometimes patients not actually understanding where they can access care and get care. We all understand how there are problems with the appropriate management and treatment of African Americans, but get online, get out of your local jurisdiction, find that specialist. And that's a way to avoid many of the things we've talked about today. That's what CIGC does, and that's what other specialty practices are doing as well. So again, look into it, be your best advocate, seek us out, or anybody in your local area that needs specialty care, and you'll get overall a better result, and hopefully will control symptoms and get pregnant in the future as well.
Listeners, for contact and for more information on the Center for Innovative GYN Care, it is innovativegyn.com. Dr. McCool, thanks so much for joining us here today on Enterprise Fit Radio. Much appreciated.
My pleasure as well. Thank you.
We've been speaking with Dr. Paul McCool, the co-founder of the Center for Innovative GYN Care, a minimally invasive GYN surgical practice for treatment of fibroids, endometriosis, and pelvic pain. And for all the details, visit innovativegyn.com.